Well, good evening. $900,000. That's how much Charleston Police Department will soon be getting to help fight the opioid epidemic and substance abuse in the city. Our Tara Jabor is working for you to explain exactly how that money will be used.
Grant has the overarching goal of preventing overdoses in our city and connecting people who struggle with substance use disorder to treatment options.
The grant will give CPD new software to track in real time who is overdosing and where it's happening. Charleston Police will then be able to communicate that information with other law enforcement agencies. The grant will also add 2 new members to the CPD team.
2 peer recovery specialists. A peer recovery specialist is someone who is in long-term recovery from substance use themselves, so they can really understand the position that these people are in and make those connections.
Rachel Lefebre says the influx of funding comes at the right time.
In 2020, we saw that Charleston County had a 54% increase in overdose deaths compared to the previous year. We know this is largely because of the pandemic and the isolation that caused.
Charleston City Council member Peter Shagid says the grant is a good thing for the department and city, and it comes at no cost to taxpayers.
The police have taken a very wonderful human approach to this thing, not to punish people, but to respond in a compassionate way. Hopefully this money will help in the coordinating the response to this crisis.
It will also get the community involved with using Narcan in an emergency situation.
We want to make sure that people in the community have it as well, because oftentimes it is a bystander who uses Narcan during an overdose and saves a life. So with this, we're able to provide it free of charge.
Getting answers about the safety of the IOP Connector and its lack of an emergency lane. Our Amy Russo is live near the connector tonight. And Amy, you talked to city council members as well as DOT, and what are they telling you? What's the deal?
Tessa, I can say this. Everyone agrees that safety is the #1 priority of those coming on and off the island. But there are different ideas floating around what this connector should look like.
The city was certainly surprised when DOT changed the configuration and took out the emergency lane on us.
It was a move made by the South Carolina Department of Transportation. The Isle of Palms connector used to have 2 pedestrian and bike lanes and an emergency lane. Now the emergency lane is gone. New Mayor Philip Pounds would like to see that emergency lane back.
What do you kind of say to those people who are riding their bikes over the connector right now, knowing that you want it changed back to an emergency lane?
Yeah, well, I think there's room for both. You know, I think you can still have bike lane, pedestrian lane, and the emergency lane the way it was configured before.
He wants it done by Memorial Day.
Not sure that any additional changes to the Isle of Palms connector are going to change any of the safety issues for motorists, any of the space for motorists, other than to take away from vulnerable road users.
That's Katie Zimmerman. She's an avid bike rider and says the connector is good as is. But island residents disagree.
If you're on the island and you have a medical emergency, getting off the island can be problematic.
I took concerns to DOT.
I know SCDOT did end up repainting it last year to add in 2 bike and pedestrian lanes, took out the emergency lane. Can you kind of tell us why that is?
Well, the key word you just said was painted.
Leaders say the width of the lanes are still the same, so the connector is still wide enough for cars to pull over for emergency vehicles. But why change the connector in the first place?
Our complete streets, we've been working with the city and the county and a lot of groups to work with them to introduce bike lanes where possible.
The connector is a state-owned road. IOP leaders tell me they're hopeful they can collaborate with SCDOT so a compromise can be made.
Vacant 6-story building in North Charleston may have a new purpose. Developers are considering the former Navy hospital on Noisette Boulevard to create luxury housing, but not everyone agrees with it. Amy Russo is working for you tonight. She explains why one man says this building could be a solution to homelessness.
What's the city's response to there finally being something in the works?
Hallelujah.
25 years of vacancy, and now the former Naval Hospital on Noisette Boulevard may be getting some much-needed TLC.
We plan on converting it to a residential community with a little bit of retail on the first floor.
Camino Verde Group is a Las Vegas-based developer. They plan on taking the $12 million building with 6 stories worth of potential and creating a luxury community.
We're hoping to start construction in the summer, and that people could be moving in 18 months or less.
But not everyone agrees luxury living is needed here.
What are your thoughts about that building in North Charleston?
Hearing that it's now has a possibility of being something, I guess we are concerned that they're sort of not using it for what the priority is in our community.
Aaron Comstock is the founder of Uplift Charleston, an advocacy group for the homeless. He thinks this building could be the solution to those without a home.
Something that we could use for homeless shelter, because we only have one. It's downtown. It's full all the time. We have so many more, hundreds, if not over 1,000 people living around the Low Country who are homeless. This has so many rooms that it could be used to house homeless folks from all over the Low Country.
The developer says he doesn't feel this property is the best fit for a homeless shelter.
We just don't think this site, especially with the investors, our partners in this project, that it would be best suited for here.
But says they're open to other options.
If we can find a property to do that in the Low Country, we would absolutely do that.